I'm Sarah Baldwin. I'm a PT here at NCH Healthcare System, and today I'm going to talk to you about posterior hip precautions. Depending on the type of surgery your doctor does, there are certain things you're not going to be allowed to do for 6 to 8 weeks, and I'm going to go over those first. Raquel is not allowed to cross her ankles, her knees, or even cross midline. So she needs to keep her legs apart when she's sitting. When she's in bed, we'd want to roll up a blanket and put it between her legs. Also, if she has a tendency to cross her legs in sitting, I might put something between her legs just as a reminder for her. One of the other precautions she has is Raquel's not allowed to bend past 90 degrees at her hips. So Raquel's sitting back in her chair right now. Sit all the way back for me. Put your hands on your knees. Okay, when she's sitting, that's 90 degrees. It's a right angle. So when she's sitting, she's not allowed to lean forward to reach something because the angle would be less than 90 degrees. She's also not allowed to bring up her knee, like to put on her shoe, because that again makes the angle less than 90. Raquel would also not like to sit on a soft surface like a couch where her bottom would sink down as she sat. Okay. Now I'm going to have Raquel stand up. When you stand up, you can't lean forward, so you want to scoot out to the edge of your chair. Raquel, I'm going to have you pretend you have a book on your head, okay? And want you to push straight up to a stand. Beautiful job. And when she goes to sit down, she's going to put her operated leg out in front.
Is that right?
Yeah. Reach your hands back for the chair and lower yourself on down.
Let's do that part just one more
I
time.
should have made it left because that's the side.
That's okay.
Because I'm doing that.
Yeah. We'll start you off from standing up and
Okay.
so if you stand.
So.
Or you want to start from there again?
I don't care where
Okay.
we start from.
That's good.
Okay.
So to stand up, Raquel's going to scoot to the edge of her chair, put her operated leg a little bit out in front, because when she puts it forward, as you can see, that changes the angle at her hip and gives her a little leeway to lean forward. So Raquel's going to pretend she has a book on her head and foot on the ground, Raquel, and push straight up to a stand for me. And then she would reach for her walker. Now sitting down, she's going to do just the opposite. She's going to step back with this foot so that it's touching the bed, put her operated leg out in front, hands to the chair, and lower herself on down. Beautiful job. Okay. Now, put your foot on the floor. In the hospital, this chair is fine for Raquel because Raquel is not the tallest person, but anyone taller may have to sit in a higher chair. Much easier to get up and down from this chair without breaking your precautions. So Raquel, come on over here. Good job, Raquel. Raquel really hasn't had a total hip, so she can walk naturally. Go ahead and have a seat. And scoot all the way back in the chair. These chairs have a footstool, so when she's sitting, she can put her foot on there and be comfortable. So you can see, a taller person, this would be much better for maintaining the 90-degree angle. And the same thing is applied getting out. We're going to put the stool in. Raquel's going to scoot forward, putting her foot out. See the angle much bigger from a higher chair and come straight up. Thank you. Okay. And the third thing Raquel is not allowed to do is she's not allowed to turn her operated leg inward. So no twisting it inward. Just show them what you don't want to do. No turning it in. Okay. So when she's walking, she can turn to her good side without any difficulty because her foot turns out. But if she turns to her operated side, she needs to turn her foot in the direction she's going. Turn it to the right, other way. Turn your foot. Then the walker, then the other foot. Turn your foot out. No. We'll do that again.
Yeah.
Okay.
This is how I teach you. I'll turn your foot, walker, other foot.
Okay.
Okay. So start with the next precaution is no internal rotation. So Raquel is not allowed to rotate her leg inward. So when she's turning to her strong side, she can just turn normally. Turn the walker, then turn her foot, and then the other foot. But when she's turning to her operated side, she must turn out her operated foot first, then turn the walker, then the other foot. Turn out her operated foot. No, turn out a little bit more. We're just turning and step. So it's just a nice slow turn. All right, Raquel, you can back up to the chair and have a seat. Very good. Move this chair out. So next will be, you want me to do walking and then bed? Okay. Is that okay so far? I just feel that.
Yeah, I know.
Okay. So to walk now, Raquel's going to scoot forward, get her feet on the floor. Remember to put her operated leg forward. She's pushing up from the chair or bed, reaching for the walker. Now she's turning towards her good side, so we don't have to worry about her hip precaution. Just turn naturally. Okay. And when she's walking, as you can see, she's not doing a step together. She's walking normally, one foot ahead of the other. That's it. Now, in the hospital, your therapist will put a belt around your waist so we have something to hold on to you to make sure you're nice and steady. Okay, and now let's turn to your operated side, Raquel. So you can do it first. Turn the foot, turn it out, then turn the walker, then your other foot. Turn your foot out, walker, don't bring it forward, turn it out. Right. That's it. Keep going, Raquel. You know what you're doing. Okay, and we'll walk back to the bed and let you get into bed. Turn to your good side. All the way back. Okay, back up till you feel the bed. You might need to go down just a smidgen. There you go. Put your operated leg out in front, hands to the bed, head up. Good job. And have a seat. Rest your foot on the ground, honey. Now, I want you to scoot your bottom back into the bed, remembering not to lean forward. See how Raquel's leaning back? That's perfect. Now she's going to slowly start bringing her legs around. Good. See how she's keeping them apart as she goes. And in the beginning, you may need help lifting your leg up, and your therapist will do it, or we can also train your family how to assist you if you need it. But usually within a few days, you're able to get your leg up onto the bed by yourself. I'm going to have Raquel get out of bed on the side of her surgery. She can get out on either side, but usually it's a little easier to maintain your precautions by getting out on your operated side. If you got out on your good side, we'd have to watch that the leg didn't roll in as you brought it across the bed. So Raquel's going to bend her good leg up, lift her bottom, and scooch it to the edge. Keep going. Good. Now she can push herself on up to a sit, remembering her 90-degree angle, and pivot on around. Beautiful, Raquel. Alrighty. And we always have you sit for a minute just to make sure that you don't get dizzy before you get up for your walk. Raquel is now going to do the total hip replacement exercise program that you'll be doing in the hospital and for several months once you're discharged. Her first exercise are ankle pumps. She's going to do is pump her feet up and down. This is going to help her circulation so she doesn't end up getting blood clots. We recommend you do 10 times every hour. I always tell my patients, if you're watching TV, when a commercial comes on, pump your feet and you'll get plenty in. The next exercise is called a quad set. You can just relax your feet, Raquel. Push down with the back of both knees into the bed. Hold that tight for a count of 5 and then relax. And give me another one of those. So you can see she's just tightening this muscle and Raquel is breathing. You don't want to hold your breath because that will shoot your blood pressure up. Next exercise is called gluteal sets. She's going to squeeze her bottom muscles together. Pinch them tight for a count of 5 and then relax while you breathe. Another one. Squeeze, hold, 1, 2, 3, 4, 5, and relax. Our next exercise is the heel slide. And with this one, Raquel's going to bend her knee up. And I'm going to show it on her non-surgical leg. So she's going to bend her leg up, but we don't want to break that 90-degree angle. So I wouldn't want her to come way up because that would be too far. So I'm going to tell her when to stop. Go ahead and slide your heel. That's good, Raquel, and down. I'd rather have you err on less than 90 than even close to 90. That's just nice and easy. Up and down. Short arc quads are next, so we're going to put rolled up blanket under Raquel's leg. She's going to use that as her fulcrum and lift her leg up. This is not a big exercise. Everybody tries to make it harder. You're not lifting your whole leg off the bed, just your lower leg. Good job. And last but not least, Raquel will bring her leg out to the side and back into neutral. Good. And you don't want to cross midline again, so that's why I'm keeping my hand here to ensure that she doesn't cross over. Beautiful. This is usually the hardest exercise, so I know it will be difficult initially, but keep working at it and it will get easier.